la nostra prossima relatrice, Alexandra Szpak. Lei lavora come preparatrice in Polonia, provo a pronunciarla in maniera corretta, Polkowice, che è la prima serie in Polonia, vincono il campionato e fanno l'Eurolega. Ora lei ci parlerà, la relazione, come vedete, è sulla prevenzione infortuni ancora una volta e il ruolo negli infortuni al ginocchio di abduttori e adduttori. Ok? Accogliamola con un applauso.
Hello. First of all, I want to thank to the whole organization to invited me as representing my own country, beautiful Poland. And I would like to introduce you the subject of the prevention of ACL injuries. And today we will be talking about a lot of the role of the abductors and the adductors. And I will show you also the in-season monitoring for players, and from my perspective, it's going to be very interesting for the young coaches or those who will start coaching very soon. Keys in our discussion today for us, things to discuss. First is going to be my message to you as a coach, to the coaches. Second, we will be talking about the anatomical differences in the structure of the hip bone in women, in men, comparing them. Because my last 11 years on the field I spent with the men's teams, and this year I spent with the female teams. And we know that the risk of having an ACL injury from the woman's side is much more higher. The third one, factors predisposing to ACL injuries. Just to remind you a couple of things. Also injury prevention, what is injury prevention for me, from my side. A comparison of hip abduction and adduction studies, which is going to be my study that I was doing the whole season this year. Other methods of monitoring training during the season. A bit information about me. So, like I said, I'm 33. I started coaching when I was 20. I studied at Academy of Physical Education in Wrocław. So first 3 years, because I used to be in the past a swimming coach, I was doing a coaching course to be a swimming coach. And the second 2 years I spent to be a strength and conditioning coach. But like I said it before, when I was 20, I started my work. Of course, a couple of first years was for free. Probably is the same for you guys. Last year I was with the NBA. They invited me to help them in Poland to do a basketball without borders. 5 years I spent with WKS Śląsk Wrocław, which is the greatest club in Poland. We won the championships for 18 times. And I was also responsible for the Youth Academy, for the whole academy during that time. I was also in Górnik Wałbrzych, which is also the first division. WKS Śląsk is the Premier Division. And last year I was spending with Polkowice. We play EuroLeague and also the Polish League. And this here, the Help Draft, is my own program. I created this one 4 or 5 years ago, which is a volunteer program that the youth players can train for free with the professional players. They just have to do like some kind of 14 days volunteer program that they are helping the people in our country, they are helping the older people. They can choose the program, but the main thing is that they can train with us for the whole off-season which can be, because I started that during the COVID, and it was, right now, we are having fifth year with this program. So I want to ask you right now, because I know that we are having youth coaches as well here, what is your own why? Why you are coaching? Because for me, coaching is a mission. It's a mission in life, and why I like to be also a rehab coach, return to sport coach, that's kind of injury guy, or I don't want to go with Alex to the weight room, which is Alex is me, anymore, because we are doing and training a lot during the injury. So what is your own why? For me, being a coach, it is because I love helping people, I love working with people, I love to train heavy, also by myself, because I'm training also every day. And in my opinion, also the coaches has to train. Maybe not every day, but at least 2-3 times per week, it's enough. I like to have challenges in my life. That's why I became also a, we can say, rehab coach. I like to learn, and I like when my work is satisfying, and I also love to be part of the team. And it is my message to you. You can go to the Bible, and you can also read it down the Psalm first. I started my whole career from this one, because we are having the two paths in our lives, so we can choose which path we are going, but take a notes on and read it in your home when you will be very calm, when it's going to be silent around you, the Psalm first. Okay, so now we're going to start a quick reminding. We will start with the anatomic phase, because when I am a rehab coach, we can say that, and strength and conditioning, I am always trying to get the picture of the joint that I am dealing with, of the bone that I am dealing with. So it's a very good opportunity for us to remind something from the anatomy, because in my opinion, we have to respect, as a coaches, we have to respect the law of anatomy, but especially we have to respect the law of physics, because all of the time in our life, in our situations with the athletes, we have to deal with the forces that they are working on our body. That's why we have to also respect the physics. That's why we are having the first law of Newton, the second law of Newton. Please also remind yourself with that when you will be at home. We're going to start with the picture. As you can see, the male pelvis we are having, if we're talking about the public arch, is something between 60-70 degrees. Comparing to the female pelvis, it's going to be a bit bigger, because we are giving a childbirth, and also we are having 80-90 degrees. Also here we are having heart-shaped, if we're talking about the deeper pelvic cavity, and here we are having oval-shaped. And much more important here, if we're talking about the female pelvis, it's shorter, and it's wider. We are going back to the first one. So if we will compare these two, so male hip bone, it has thicker and also the heavier bone, and it's narrower and also the smaller in the structure. And the female, it has thinner, lighter, and denser bone, and it's broadened and also bigger in the structure. And the most important thing, if we're talking about the female pelvis, it facilitates childbirth and makes delivery much more easier. And also, I was talking about a pelvic inlet. So a male hip bone has a heart-shaped pelvic inlet, And if we're talking about the female hip bone, a female hip bone has a slight oval shaped pelvic inlet. You don't have to remember all of the time as a coaches every day that thing. When you will be dealing with some kind of injury, you can go back to the study from your university, because we all started from this. We all started from anatomy on university, and it's very important for us to respect that. That was first one. The second one, you can use right now your imagination where is going to be the adductors and abductors, and how long they will be, what is going to be look like. Just close your eyes for a second and just imagine yourself how it's going to look like when we will be moving, starting from the hip joint. Because like I said it before, when I am starting to deal with some kind of injury, first I'm taking a piece of paper like this one. And if you are having, okay, I am having the notes here, but if you are having a piece of paper and a pen, you can also use it and scribe here the female pelvis, and it's going to be much more easier for your brain just to remember that and just to explain. And here we are having also, just for your brain, just to start, imagine how it's look like and how this connection is very important for us. Okay, hip joint function. We are having, in my opinion, three. The most important also, it's a reminder for you that the first one is providing the balance, yeah? And supporting for your upper body, moving your upper leg, this is the second one. And third one, holding your body weight. It's also to remind us that we will be talking about the abductors and adductors, and we have to start from somewhere. Okay, and we are starting with the abduction. What is abduction? When we are doing a lot of lateral, especially lateral exercises, like jumping to the sides, when our athlete is also moving on the court, it's a lot of lateral movement. So just think about that when we will be thinking about the hip abduction. It's more like lateral movement. And hip abduction is the movement of the leg away from the midline of the body. So for example, if we are stepping to the side, yeah? If you are getting out of the bed, if we are getting out of the car, it's all of that about the abduction. We also use it in walking to stop unsupported leg to falling into space. And here we are, also about the abductors. The primary hip abductor muscle also is to remind us from anatomy is gluteus medius, gluteus minimus, and tensor fasciae latae. The secondary hip abductors include the piriformis, sartorius, and superior fibers of the gluteus maximus. And the hip abductor muscles contribute to various actions, including pelvic stabilization during walking and running. Why I choose the abductors and adductors, and why, in my opinion, they are very important if we're talking about the prevention, especially prevention injury of ACL. You will see on the study that I did this year. But in my opinion, during the season, we are overdosing many things on the weight training in the weight room. And I will prove that we have to do a bit less weights and start thinking about our body as that everything is connected in our body, and take care of especially our hip. So everything in our body is connected, like I said before, and start to think about that, not only about the knee, about the ankle, about the trunk, about our back, but about that everything in our body is connected. Because when I am having, for example, I am having a very serious injury on my back because of, obviously, sport. So I will be supporting my back, I will be doing a deadlifts all of the time? No, because my back is very hurting me during deadlift. I am not weighting as a deadlift like 120 kilograms anymore on the bar, but my max was 135, believe me. Right now, for me, 40, 50 kilograms, it's enough because my back is hurting me very much. That's why I'm doing a lot of exercises of glutes, a lot of quads, especially hamstrings, to not to have asymmetry between the hamstrings and between the quads. And also, I am take care of very much about my hip joint. And connection between hip bone and adductor. The muscle is in the medial compartment of the tight and colloquially known as the hip adductors. We are having here on the pictures. And there are 4 primary muscles in this group. We are having adductor longus, adductor brevis, magnus, and gracilis. And which one you are thinking is the most injured muscle from this group? Somebody knows? Okay, so the first one, we are having, of course, the adductor magnus, but also the gracilis will be combined into having injury from my, of course, experience. But, of course, the adductor magnus, also the gracilis, is more superficial and medial of the hip adductor, and is mostly the injury is common from one of these two. And also the strain of the adductor muscle is the underlying cause of a groin strain, adductor tendinopathy, among the most common sport injuries. The proximal part of the muscle is most commonly affected, tearing near their bony attachment in the pelvis. It's also a reminder us that we will be talking about, we are starting from the hip. Right now we are having some remind about the abductors and adductors, and then we will be having some connection between them. Injury prevention. When you are hearing about the injury prevention, what you are having in your head? Come on. Injury prevention. What you are doing to prevent the injury? Nothing. Yeah? Strength training. Okay, what else? Okay, okay. So we are having, of course, we are having also no shortcuts. Process is time, is taking a time. So please be careful when you are doing, especially at normal training, a rehab training is a process and it takes time. First step from me when we are starting the prevention is mobility. So we are starting with the players, we are starting barefoot without the shoes. The first 10, 15 minutes, sometimes we are having 20 minutes when we were, for example, we were tripping for a week to get the 3 games. We are starting for even 30 minutes a mobility, and we are starting barefoot. I really like to train without the shoes, without the shoes. So we start each training with a mobility session, and we are implementing in our warm-up before the main session. And we are doing, of course, we are doing the whole mobility drills, this, always before the main training on the court. So if you are having 2 sessions per day, we are doing 2 times, but it's a way different. In the morning, it's more calm. We are doing sometimes more yoga stuff. At the evening, we are doing more to waking up ourselves. So I like to also start with some kind of fun with the team. like with the kids, and they really like it. So how long it should be, what kind of exercise we are doing. You can find many exercises right now on YouTube, on Instagram. You can find it, but create your own routine. Routine should be the same. We can always change some exercises because the players, we know that the season is very long and the players can be bored. So please sometimes just rechange the exercises, and of course it depends. The main session of the mobility for me typically it will be 10 minutes. I am always convincing the coaches and they are always agreed because the main argument when I am speaking with the coaches is, coach, I am responsible for this group of the people. It's not your responsibility if we're talking about the injuries. When some of the girls will be injured, it's going to be my fault, not yours. And he will always told you that it's your fault. So be careful. And please convince the coaches that longer time for the warm-up is better. And of course, it depends. Like I said, typically 10 minutes, maybe 15 minutes. And here we focus largely on the mobilization of hip joint. For hip joint is almost 8-10 minutes. We are doing large things. If you're talking about the hip, I really like to do also a mobility but load. So keeping some, if you are doing 90-90, just add some ball or just add some dumbbell, and you can move also with a bit load. And also in the training session, we are doing it. At the end of mobilization, we can start working on the mini band, on power band, but before that, we're gonna also add something else, which is gonna be isometric training. I am always doing isometric training in the end of the warm-ups after the mobility. And if we're talking about the isometric training, we are also doing the core exercises, which is include because we are doing planks and all of that stuff that you know. Okay, what about the ACL injuries? Here, 70%, it's your number as a coaches, that you are having influence. We are having influence on 70% of the whole injuries. So non-contact injury mechanism are responsible for approximately 70% ACL ruptures, and it's our responsibility on the 70%. When we can expect the problems? First of all, we will focus here on women because they are much more predisposed to ACL injury. And we will address the basic issues here and also show at the end the lower activity of the adductor longus muscles in the case of ACL. So you have to know, like as a coaches, if we are having responsibilities, we have to prepare ourselves. How we are preparing ourselves to our work, I will give you for some kind of like example a bit later, but you should keep that in your mind that you are responsible for this group of the people and for the health. Causes of ACL injuries. The most important, if we're talking about the females, and it's also a big difference, is a menstrual cycle phase control. When I am doing an interview with the players before, when we are starting the preseason, I'm always asking them about the menstrual cycle. If they are having some problems with the hormones, it's also very important. That's why we are also doing a blood test before the preseason camp. And of course, women are more sustainable to injuries in the first half of menstrual cycle in the pre-ovulation phase. Second one is less stiffness in the knee muscles. In women, excessive ACL loads per unit of body should be accepted due to lower stiffness of the knee muscles. It's also to remind us what is the causes of ACL injuries. Anatomical differences in the structure of the hip adductors and adductors. We know that already. That is a big difference. You know, you remember the second picture? Yeah, you remember the bones, the hip joint. So that's the difference. And also, imbalance between the hamstring and quadriceps strength. It's most important if we're talking about the re-tearing of ACL. Is this imbalance? When I am doing a training, when I am doing a rehab program for the athletes, I'm always try to have zero. Okay, it's not possible. Sometimes it's possible, but we are humans and we are here. So it's something between 5–7% asymmetry. It's okay. It's okay. But we are keeping in that mind that we have to have the good balance between the hamstrings and also quadriceps strength. And I will show you which device I'm using to get that if we are having the asymmetry or no. The other causes of ACL, of course, we are having sudden change of direction. Of course, we are having sudden change in speed when the foot is firmly planted. Wider pelvis, like we said before, and also much looser ligaments than in men. That's the most common causes if we're talking about the ACL injuries. In my opinion, we are having also the lack of warm-ups. Maybe I will be not thinking about the stretches after the training because it depends, like Pepe said. Some of the players, they like to do stretches. Some of them, they are not doing. I am not forcing them to do it. If somebody is telling me, no, I will not do stretch, okay, you are by yourself. But but they are always having a notes for me that if somebody will be hurting during the season and will be not listening to me, it's your fault. So everyone in the team is listening. Especially if we're talking about the female, because with the female teams is, in my opinion, much more easier to work with than with men. Okay, what do ACL injuries have to do with hip functions? Like I said it before, we are having a lot of causes when we will be not taking care of the hip joint, taking care about the pelvis. Hip with core as a stabilizer for the knee, and everything in our body is connected. So adductors and abductors, they are connecting with our hip joint, they are connecting with our hip bone, and have been shown too much weaker after injury in the operated leg compared to the uninjured leg, of course. And based on this conclusion, as well as tested performed during and before the season, abductors and adductors strain during the season may predispose us to ACL injury. That's why I am doing a lot of studies and a lot of tests during the season to see if I can have the, for example, ACL, but it doesn't have to be the ACL injury in the future or not, especially before the playoffs. The playoffs is our main goal for the whole season, to train to win. A proper assessment of predisposition, especially of female players, can protect us from injury during the season. And we are having, like I said before, we are having our influence on the 70%, which are not contact injuries, which can be caused by incorrect movements, also the lack of the warm-ups, especially before the games. This is likely to be related to too much training load, poor mobility, improper preparation of the player for training or match. And of course, as I said it before, we have to respect the law of the physics about the forces that they are generated in the human body and they are generated on our body. So we are having 70% of contactless contact if we're talking about the ACL injuries. Direct contact is 30% and indirect contact is 5%. On 70%, we have to take care, responsibility of 70%. Second step, like I said it before, we are starting with mobility, and I'm trying to have 10 minutes to mobilize the whole body. Then before we will start the strength training, we are starting also the mini bands. Sometimes we are doing mini bands, sometimes not. It depends on me if I want to do it or not. And also I recommend highly isometric training, also for the core. Like I said, we have to activate the whole body, so it's also good to have some core exercises. And I know when I was with the NBA coaches, they are always doing, but they are starting from isometric. When the athlete is coming to the gym, to the weight room, they are starting from isometric, but I like to go with the isometric phase a bit later. And also we are doing mini plyo training, also barefoot jumps. So we are on the mats and we are going in the front, we are going to the sides, we are going to do some lateral jumps, so small jumps. Also we are doing calf raises without the shoes. We are doing some one leg jumps, and later we can move smoothly into the training. So I really like to start the warm-up with the whole team. Before the game we are having different kind of routine that I will show you, but the main routine for warm-up before the training we are doing with the whole team to make sure that everyone will have the same preparation for the training. In addition to previously mentioned movements, what kind of movements should be our training include? Not only do bench press, not only doing squats, and please use that in your program. So sudden change deceleration, we are having jumping, we are having rotation, we are having sudden change of direction, we are having also sudden change of speed. And you can use that. I really like to use it, the sudden change of speed, direction, and also deceleration in the second warm-up before the second training. Of course, if we are, for example, if we are having the one session per day, we can use it like after the mobility phase, which is going to be a bit shorter, but we will add some kind of these movements. So before the second session, I really like to have some kind of jog with the deceleration. So use only the voice, the signal that they will be changing the tempo of running. Also with the direction, we are having because you guys probably have your own like kind of routine before the game when you are with the team on the field. So I would like to have also with them a bit connection. And we are doing before the game a sudden change of direction a bit. That's how it looks like in theory, but I'm really practitionist, and how it looks like in practice. And this one can be very useful for the coaches that they don't have the money, or they are starting, or they want to have something else that is much more quicker because when I am in the team, I am only strength coach, that I am responsible for all of the papers, I am responsible for the programming, I am responsible for the trainings with the injured players, and I am having also one physio. So you don't have to have, like also Pepe said about that, when you are having really great tools, for example, catapult, when you are having something else, it's really great to have them, but if you are having a much more bigger coaching team. So first, I'm using the monitoring by Dynamo, which is wall system. For me, it's very useful. And in my opinion, it's not that expensive. It can cost 200 euros per month, so it's not that kind of expensive for this technology. But I am using that a lot during the season, and in my opinion, it's very useful, and we should have that all here as a strength coaches. We should have that one. Because it's very light, we can use it when we will be on the game, for example, but maybe once I bring it to the games, we only use it at facility, but it's very accurate because I was using a couple more system, and for me, they are having the best technology right now, so far. We are having also the assessment of body posture. It's very simple. You have to have only a phone, and you are having the pictures in the same place. As you can see, we are having also game ready here. But we are having this in physio room, and we are going to have the pictures from the front, back, and side photos. And my physio is describing this photo is her role or his. I'm using also the program is Atlas SR. Is free if you are subscribing the complementary training. I used to have the account there from Mladen, and I really like that one because you are having the application in the phone, and after the training, each of the athlete can fill in. But it was very useful during the preseason camp. During the season, for me, it wasn't very easy to convince players to use that. So on the preseason, every day was perfect, 100%, every athlete feeling. I was very happy sitting at home and watch the result. But after that, it was the numbers of the players that were filling in, it was going down, but it should be also coming from the coach that you are working with. I am talking about the head coach. Monitoring the time on the court of each players, and it's an example of a sparring game. So I really like to do it when we are having the preseason, because when we are having the season and I have to sit with iPad or something else on the bench and count the minutes, count the seconds that somebody is going on the field, it can be very problematic because I am not focusing on what is going on the court, and I cannot see for example, injury, that somebody will be injured on the court or something else. And I really enjoyed the game. Really enjoyed the game. That's why I started to be a coach. And here we are having from 2 sparrings that, for example, the first person, the second was 5 minutes, and we are having also the starting 5s. So we are having start, injury. When we are having injury, I'm also giving a note that we are having injury, and then I'm sending this to the head coaches. Remember, when your head coach is not asking you to do the report, to do nothing, do it. Do it anyway, because it's your insurance. It's your kind of insurance. When I was started, I was giving my head coach every week a report. It was a health report of the players. It was a report of every training that we did. So it's good to have the email conversation also with the coaches. For example, if you will be losing a job in the end of the season or something else, or if somebody will be blaming you for injuries. And I recommend that you familiarize yourself with that companies. Also, we are having here the great companies that I will suggest to go with the guys and to ask them about the technology that they are having. We are having here the microgate, we are having the K-Sport, we are having the catapult, all of that, that's great. I'm using, like I said before, the athletes SR, I'm using the Volt. So far, I'm using the Dynamo system. They are having much more, but right now, if the club will buy something more to measure of the body, I will be happy about that. Of course, we are having our friends with SK. We are having a Whoop that I am having, and in my opinion, I'm using that for 2 years, and it's accurate and it's worth the money. It's worth the money. I was having 3 players who was having the Whoop, and they will always send it to me on WhatsApp, the screenshot from the phone. And in my opinion, when I am training, it's very accurate, and you can use the Whoop. It costs like 30 euros per month, but it's really worth it. Of course, we are having Mike Boyle, and we are having complementary training, and you can find many, for example, Excel sheets, that you can use also for free on complementary training. They are doing a lot. I am having all of these, and they are very useful. It's much quicker to do the sheets with the scores, for example, from the tests or from the trainings. I am also really like to do the running analysis, and I'm also using the phone to do that. We are having the apps, and it's also very accurate to the very professional level of the running analysis, because I used to also train the track and field, and it's also very accurate. It's very similar if we're talking about the score. Of course, it's good to have the video in slow-mo, and then if somebody is having a problems with running with running on the field, we have to take care of that athletes too and learn how to run properly, and we are having that time during the warm-ups, because during the training it's not possibility to teach somebody how to run, or outside, of course, of the training. And I would like to say one more thing. If we are doing a test, what we are doing, how we are doing, so we are doing this because every athlete's first 2 weeks, for me, we are doing the same. All of the athletes, of course, if somebody is injured, if somebody don't want to do something, okay, we are replacing that exercises, but the first 2 weeks, we are teaching techniques, we are doing everything the same. After 2 weeks, every athlete has, I'm doing the individual plan for those athletes, because we are having the scores also from the tests, and I am also interviewing all of the athletes to ask them what they want to do, what they want to working, because they will be much more happier, they will be much more satisfying if we will get them what they want. Not, of course, 100%, but we can add something. And here we are having a case study. This year I was having a 23-year-old female basketball player, and she was having three ACL ruptures. So we started from the test implementation, and for each player in the team, we choose the same set of tests, increase depending of the problems. Here we are having max force of the abduction, and later in the next slides you will see that the abduction is the thing that we have to watch during the whole season, because we can overdosing or over-implementing the training in our way. So here we are having the abduction, and also here we are having the average time to pick the force that is going high, so the fatigue and the stress in the body is much higher, but obviously during the season the stress is going up. Sorry. How many times do we test? We are testing, it depends, because sometimes we are having the players that they are only for example, 2 months, that they are only for the pre-season camp to help us. So it can be one test for those guys, but we can. But I am repeating tests every. I am having some kind of phase during the season, and we are going to repeat 2-3 times tests during the season. If I am having the injured players, of course, more. I am also like to do the test of range of motion. If somebody is having the problem with the hip, if somebody has problem with the shoulder, if somebody has another problem, maybe with the head, I'm doing it 2-3 times, and we are doing it always before the main session. And testing standard must be always the same, and we are trying to conduct the test when the athletes, they are feeling okay, that they are not, for example, they don't have some kind of virus, they are healthy enough, they are not injured. So the standard must be always the same. And here we are having the pictures from the front, from the side, from the back. Very easy to use. Like I said, we only need our phones. And here we are having the description from my physio, because she is doing it. And here we are having the description from the front, from the side, and from the back. And we can also, from here, expect some kind of problems. As you can see about the hip, she's also very thin. She's also having a problem with the shin splits, and is probably one of the cause of the ACL injuries more often. We also add to her the supplementation of calcium, which is also very important. We were also watching on the body weight, because it's not very easy to manage that kind of athletes who is very thin, lean, to manage that she will be not having any injury. And I can say this year I am very happy, because this was the first year of this player that it was without any injury. We struggle a bit with the shin splits, but it's normal. I am also having the shin splits when I am running too much. But for now, we didn't have any problem with the knees. We didn't have any problems with the ACL, and it was her first year, because every year for 4 years she was having a surgery or something else. So our job can be also very satisfying. We collect information such as, and you can use the paper, you can use the laptop, you can use the phone to collect the information. You are having many options here. So we are collecting information such as body weight, height, fat percentages, and I really like to use the capillar. I am not using Tanita or something else. For me, it's not accurate. Capillar it is. Dominant foot, which foot is dominant. Date of last menstruation, if we're talking about the female players, whether it's regular, and whether we are having the hormone disorders or not. Also, a lot of women and a lot of athletes, they are having eating disorders. So you have to, if you will have a trust with them, just start the conversation about the eating disorders, because from my experience, a lot of them, right now, they are having eating disorders. So when we are having the eating disorders, we are more predisposed to get also the injury. Of course, injury, muscle grade, contact or non-contact, when it was very similar to what Pepe said. program goal individual, of course, what the athlete wants. We have to ask them what they want, and we have to have a conversation with them, what we can do with them for the whole season. Of course, it's not the whole season. We have to, especially winning the games. But with the young players or with the bench players, we can do a lot more. And other, of course, important information, past programs, what type of training was done before, etc. And also contact with the coaches. For example, if I was having a player who was with me in the team, I was asking the coach that I know that she was training with, and this year was Catarina from here, from Italy, and she helped me a lot because I was having a big problem with a player. We were having some kind of problems with her, and I can contact with someone else and ask of the other perspective. And it's very important that we as a society, as a coaches, we have to work together because our goal is to get is also winning, but we have to have the athletes especially healthy, in good shape. So it's our main goal to have athletes in good shape, and we have to, as a society, we have to cooperate with each other to make that happen. Of course, we are having a counter movement jump test, and I am doing it on my jump lab. Sometimes I am having some kind of force plates, force desk, but my jump lab, if you don't have a money, or if you don't want to spend, here in Poland, we have to spend, for example, 10,000 zloty to get, but if you are at the beginning, you don't have that kind of money, and in my opinion, okay, if the club is spending the money, it's okay. If you have to spend the money, think about that. If you are planning to be a coach for a long time, or if you will be a coach for 5 or 6 years. But my jump lab is my jump 2 or something like this. The app is very accurate, and here we are having the third one before coming into contact. So we checked. First test was in August, then we are having in September, then in November before going to the contact. Before that, of course, we did also biodex. We did also a lot of the stuff, but that I will be speaking on in the next slides. But we are doing also the counter movement jump. We are doing knee extension seated. As you can see, this is the first result during the preseason. We are having max force and also average time to pick the force. And I was really satisfied with this one, with average time to picking the force, because it means for me that she is ready to picking the bigger force in shorter time. And here we are having the max force for the whole season was almost the same, okay? We are having some comparison and asymmetry between the right leg. The right leg is the orange one, and the left one, we are having the blue one. So sometimes we are having the asymmetry, but in the end, you can see that they were very similar, and I was very happy about that. That's why we are doing the tests. Also, like I said it before, we have to check the asymmetry before the hamstrings and quads. So I like to do also the knee flexion seated test. And also we are starting here. Here we are having, okay, we went down, but nothing happened. She felt very well. here we are having that we were having a problem with the right leg, and she was having some discomfort in the right leg from the interview because we were talking a lot, and after a couple of months I knew her well. But this test is not for that we always have to do, because when you will start to do these tests, athletes always will be expecting that they will be better. So you have to explain them that way, that if the season will be, if you will be before the playoffs, they will be a bit tired. So the result will be not the same as it was before the season or during the preseason camp. And the test I choose for the team, the first one, we are having the knee extension seated. We are having knee flexion seated, shoulder, external rotation, internal rotation seated, and we are having elbow 90 degrees, both sides. We are having ankle inversion long sitting, plaiting grade, and we are having also inversion long sitting, plaiting grade. So this is the first part. The second part, we are having hip abduction side lying. We are having hip adduction supine, ankle dorsiflexion long sitting, plantar flexion, and shoulder scaption standing. Of course, we can do even like 500 tests, but I am picking those because for me they are having much more sense. You can choose even 3, you can choose 5. I'm choosing this one. This is the base. If somebody is telling me during the interview, before the preseason will start, I am adding some specific tests for this muscle group. If somebody is telling me that is having more problems during the season with the ankles, I'm choosing more tests for the ankles. If somebody is telling me that somebody is having problems with the back, I'm choosing the right ones for the back to have what is the cause of the injury. I'm always having a question in my mind, what is the cause of this injury? Or if it's the injury that it repeated very, very often, we have to search the cause. So here I'm also doing the T-test and lane agility. It's also very, how to say it? It's not expensive, it's very cheap. So you can use only tapes on the floor. You can have your coach, you can have your assistant coach, your physio, and they will take times. And we are picking up the best ones. And the athletes, if somebody wants to try it 4 times, okay, why not? But after that, they will have 2 or 3 repetitions of these tests. So I'm doing the T-test, and lane agility is very useful also, and is very, if you will compare the results from the other tests, it will be very similar, and you will have the whole story. And for me, it's very fascinating that we can have the whole picture of the player to do everything. Of course, if somebody is lazy, we can say that somebody is lazy. But this year, when I was doing the test with the female, I wasn't have that problem at all. We are having the quadriceps program, which I was also made. I'm using also the program. You can add your own exercises and you can generate it. So you will have a shorter time. I mean, you will be doing it in shorter time. So here is, for example, a program of mobility. It's not exactly a quadriceps program, but it can be microdosing before every game. So when we are going to the gym, we are having a great wall, and on this wall we are having the names of the players, and on each name we are having the programs. And when I am in the gym 3 hours before the game, because I am always 3 hours before the game, With some injured players, we are starting already the proper training. And with other one, we are starting 2 hours, sometimes 1.5. It depends on the experience of the players. But it's very easy when you will get the piece of the paper and they know how to do it. And after first weeks, they will know what kind of exercise they also want to replace, because many of athletes, they don't know what to do, what is the best for them to do before the game. So we have to figure it out together. So still we have to have a good communication with those players, but it's very useful. And here we are having, I'm sending always to the head coach when I am planning and when I am I'm trying to moderate the intensity, and I am suggesting the head coach what it should look like. For example, I am also here when I am playing some tests. I'm also putting up those tests here. We never doing a test for a 1 rep. We are doing for 3 or 2. It depends. We are doing also the pull-ups and all of that stuff, but we will be not talking about that. Here we are having the math test. Here we are having that it's going to be moderate day. Then we are having height. If we're talking about the workload, then other moderate, height, moderate, and then off. Okay, so the moderate and high also will be a different thing to the players, because somebody will be on the preseason will be well prepared, and somebody will be, for example, overweight. But it's good to have those things. What can we see during the season to react quickly enough? Like I said it before, the normal conversation with the players is most important thing. Of course, to having the connection with the whole staff, with the coach, with physio. I suggest sending the emails. It can be also easier when we will have some time at home and we will be writing down the emails. My last head coach know everything, and we had in my last team we had very good connection. Probably that's why we didn't have any serious injury. Maybe 2 times somebody sprained the ankle, but that's it. We didn't have any serious injury because we had really good communication, in my opinion, and we cooperate with ourselves. Control of the training process, very simple. First testing, then training implementation, and then retesting. If the training is working or is not. I really like to have the answer if I am doing a good job or not. Do your own research. As a coaches, we have to explore. I know that we are having a lot of platforms like PubMed or something else. We are having a lot of this, but I will suggest to do your own research, to have an interest in your job. Because when you will be passionate about it, when you want to explore something, it's going to be much more interesting in your life, because you will spend with those guys and you will be thinking about those people for 24 hours per 7 days. The impact of training loads on hip adductors and adductors, the first alarm signals. Okay, so my research group, because we can do our research, each of you can do some research. So my research group consists of 15 professional players, female, and age between 19 and 33 years old. What tests we use? We use Athlete SR, Dynamo, CMJ, and talking, normal talk. How many athletes in the research group had suffered injuries? Out of 15 players, 4 had ACL surgeries in the past, including 1 after surgery. 3 had Achilles problems in the past, 3 shin splits during the season. and 4 had strains in the knee joint. About the shin splits, because it's also we can have the we can deal in the future with the ACL if we will be not taking care about the shin splits. So I will suggest to tell the coaches that we are having that kind of problems, and it's very hurting, and we cannot do that much on this kind of injury. Procedure 5 tests, including pre-season, during the season. If any athletes had suffered an injury, even a minor one, or overload, we introduce additional tests, like I said before. Examinations such as MRI, but I will tell that later. Conclusion, only lazy people don't make progress. And here we are having our 14 players, because one of the players, she was only for 2 months. That's why she is not here, but you can say this is the player from starting 5. They most common were not on the bench. This is the others, the young ones, the players who went from the bench. And we can see about the adductors, okay, we did some progress on that, even during the season. About the abductors, here we are having some regress. That's why I refused later, when we started the playoffs, to do a lot of the weights, a lot of the jumps, especially with the loads, with the weights. If we're talking about the lateral jumps, we didn't do many of, for example, hip thrust. I really like to do more glute bridge than hip thrust. It's much more easier to implement the right technique. For example, if we are doing the clean and jerks, we are using a lot of dumbbells. We are not using the barbell, because it's also very very not useful, but it's very easy. That is very easy. Okay, so here we are having the first one, ITB problems. So here we are having the problems that we had. So some kind of like, if someone was complaining about something, it's here. So we can say that we overload the abductors, and we have to watch on those abductors. Because when I was starting this presentation, we have to watch on the adductors and abductors if we're talking about the ACL risk, especially in women. So I was not going to do a lot of because I really, I am always putting a lot of exercise for the lower body. We are doing every day something. It can be small, it can be a bit heavier, but we are doing something to get just the warming up the lower body. But here I refuse to do that, because I can see that we can do overload. And here we are having one player, that is Julia. She's after 3 ACLs, and we can see the max force that we generate if we're talking about the abductors went down. If we're talking about the adductors, they stay the same. And here we are having the fastest player in the team. This girl probably is also the fastest, or one of the fastest in EuroLeague. She was very fast. So here, when we started the adductors, and here we are having the abductors, but they stay at we can say, the same level. So it wasn't crucial score for us. A player who was struggling with MCL before the preseason and hamstring tears, also it's looking very fine, but we also didn't do anything heavier during and before the playoffs. During the preseason, here we are having from the first table the player who was having the problem with the left foot surgery in the past, but we did a lot of progress because she wasn't like to do a weight room. That's why when we started to do something more, she was doing a progress much quicker. Then we are having player 14 overload and player 8 also overload from the table. This one. Oh, yeah, this one. And thoughts in the end of my presentation. What does this tell us? Non-contact injury mechanisms are responsible for approximately 70 of ACL ruptures and other injuries, and we can influence that. Please remember this. Hip adductor muscle can help control dynamic knee valgus, but reducing hip adduction and internal rotation associated with dynamic knee valgus also. Strengthening program targeting the hip abductors are often included following ACL reconstruction to help normalize lower extremity strength and facilitate normal trunk. And think for yourself and trust your intuition. And the last one, examination to start contact training. This is how we are doing in Polkowice. So we are trying to have two medical opinions. Because I am not always satisfied after the first one. Okay, I am not a doctor, I am not a physio, I am coach. So this is my perspective as a coach. But if I am only one strength coach and I am having only one physio, I have to sometimes doing both. I am not doing any, for example, massage or something else. I am not doing a manual therapy, but if we're talking about the rehab program, rehab trainings, I am responsible for that. And I really like to have two opinions from independent doctors. Medical tests, including imaging tests, are necessary for every injury. If the physio is telling you that, no, it's okay, it's just sprained ankle. No, in 2 months, it can be worse, it can be something else. So please, every time, use ultrasound, at least. If it's not a big problem, then X-ray, and then MRI. But it's very important because no one from here, we are not magician, we are not seeing what is inside of our body. So please use this kind of tests. I am also providing the Biodex test, and we are using that in my university of physical education. So we are, for example, we are having the right one in sports university, in biomechanics facilities. Our test, re-interview photos, information gathering, room test, strength test, and also wall test. Physiotherapist consultation, consultation with a physiotherapist about the further treatment process, because we will be in this process with our physio and with our athlete. And also our athlete has to have a trust in our work, what we are doing. So try to do the best of yourself. And also we are doing the interview with the head coach, what he is expecting from us. If, for example, the head coach will tell us that the player, this is our main player, and it has to be on the court in 2 months or in 1 month, but this kind of surgery, for example, is a hamstring. For me, the hamstring is very serious injury. It can be re-tear. For example, if we will have less time to regenerate our body, it cannot be enough time. So we have to speak with our our head coach. This is my phone and my email. If you will have some questions, you can write it. Please, I am very open and I can help you if I will have a knowledge. And that's it. If you are having some questions, you can ask me right now.